Ever find yourself reaching for another coffee after pulling an all-nighter and wonder, how is my body even functioning right now?
It's kind of amazing when you think about it.
It really is. Well, today's deep dive is all about the unsung hero that keeps everything running. The autonomic nervous system.
Your own personal autopilot.
Exactly. And we're going full-on Sherlock Holmes on this one, but instead of a magnifying glass, we've got anspharmacology.pdf as our guide.
And let me tell you, this isn't your typical dry medical textbook. We're going to uncover some seriously cool stuff about how our bodies basically run themselves.
I am so ready. So, for anyone just joining us, what are we talking about when we say autonomic nervous system?
You know how your body just does a bunch of stuff on its own without you even thinking about it?
Breathing, heartbeat, that kind of thing?
Exactly. That's your autonomic nervous system, or ANS for short. It's basically the control center for all those involuntary actions, constantly monitoring and tweaking things to keep everything running smoothly.
It's like the ultimate multitasker we never even knew we had.
Exactly. And what's super interesting is that this autopilot actually has two distinct modes of operation: the sympathetic and parasympathetic nervous systems.
Wait, so like a car having drive and reverse, but for your insides?
Yeah, kinda. They're like two sides of the same coin, and they each play a totally different but crucial role in keeping your body in balance.
Okay, now I'm really interested. So break it down for me. What's the deal with the sympathetic nervous system?
Okay, picture this. You're suddenly face to face with a bear.
Oh no, not a bear.
Right, your heart starts pounding, your palms get sweaty, you're totally focused on what to do next. That's your sympathetic nervous system, your built-in fight-or-flight response, kicking into high gear.
Ah, so it's all about prepping you for action.
Exactly. When your brain senses any kind of threat, whether it's an actual bear or just a super stressful deadline at work, the sympathetic nervous system floods your system with adrenaline, and that's what triggers those classic physical responses we were talking about.
Heart racing, tunnel vision, the whole shebang.
Yep, it's your body's way of saying, hey, time to focus up and deal with this.
Makes sense. So if the sympathetic nervous system is all about hitting the gas, what about its more chill counterpart?
Ah, yes, the parasympathetic nervous system. Think of it as the rest and digest crew coming in to calm everything down.
So after that close encounter with the bear, which hopefully never happens, the parasympathetic nervous system helps us chill out and, enjoy a nice relaxing meal.
Exactly. It slows your heart rate, lowers your blood pressure, and shifts blood flow to your digestive system to help you process that well-deserved meal. It's all about conservation and restoration.
Wow, it's amazing how these two systems work together like a perfectly synchronized dance to keep everything in check.
And just like any good dance, communication is key. And that's where neurotransmitters come in. They're basically the messengers that relay signals throughout your nervous system.
Neurotransmitters. Okay, I feel like I've heard that term before, but a little refresher wouldn't hurt. What exactly are they, and what's their role in all of this?
Imagine a relay race, right?
With a baton.
Yep. Neurotransmitters are like those batons, passing messages from one runner, or in this case, from one nerve cell to another. In the ANS, we've got two main messengers, or at least the ones we hear about most: acetylcholine and norepinephrine.
Acetylcholine, norepinephrine. So those are the ones telling your heart to speed up or your digestion to do its thing.
You got it. And it's actually even cooler than that. Think of it like a lock and key system.
Okay.
Acetylcholine and norepinephrine are the keys, and they each need to find the right lock or receptor to actually deliver their message and tell the cell what to do.
Whoa. Okay, that makes total sense. So it's not just about the messenger, but also who's getting the message and how they're interpreting it, right?
Exactly, and that's where things get really interesting, especially when we start talking about medications that target the ANS. We can actually develop drugs that act like these neurotransmitters, either mimicking their effects or blocking them entirely.
Wait, so we can manipulate the messages being sent within our own nervous systems? That's kind of mind-blowing.
It is pretty wild, but that's exactly what we do with a lot of common medications. Take atropine, for example.
Atropine. Rings a bell, but refresh my memory.
So, atropine is what we call an anticholinergic drug. Basically, it blocks acetylcholine, like cutting off the phone line before the message can get through.
Oh, I see. So if acetylcholine is trying to tell the heart to slow down, atropine is like, nope, not going to happen.
Exactly. It's like hitting the ignore button on those signals.
Wow. Yeah. And what do we use atropine for?
Well, you might have actually encountered it at the eye doctor. It's commonly used to dilate pupils during eye exams. And it can also be used during surgery to reduce secretions, which helps prevent complications.
Wow, that is so cool. So we've got something that blocks signals, but what about mimicking them? You mentioned epinephrine earlier. That's just our fancy medical term for adrenaline, right?
You got it. And when we need to give someone an extra boost of adrenaline, like in an emergency, we can give them epinephrine. It basically steps in for norepinephrine, replicating that fight or flight response we talked about earlier.
So it's like slamming on the gas pedal of the nervous system.
Pretty much. It's a lifesaver in situations like severe allergic reactions or cardiac arrest. It can quite literally jumpstart the system when it needs it most.
It's amazing how we've learned to tap into these intricate mechanisms within our bodies. So we've covered boosting signals. But can we also block those fight or flight signals when they're not actually needed? Like, say, for someone dealing with anxiety.
That's a great question, and that's where understanding those specific receptor types becomes really crucial. Remember how we were talking about acetylcholine and norepinephrine needing the right key to deliver their message?
Yeah, the lock and key thing.
Right. Well, with something like anxiety, where that sympathetic nervous system might be stuck in overdrive.
Always ready for that bear encounter.
Exactly. We can use medications like beta blockers, which specifically block the beta receptors that norepinephrine and epinephrine would normally bind to. It's like giving those stress signals a much-needed timeout.
Beta blockers, I've definitely heard of those. Aren't they often used to manage high blood pressure?
They are. They're really good at calming down those overactive stress responses, which can contribute to a whole range of conditions like hypertension, heart conditions, even migraines. It's like hitting the chill button on an overstimulated system.
It's incredible how we can target something as seemingly invisible and complex as the nervous system with such precision. But what happens when this finely tuned system gets thrown out of whack all on its own? Like, what causes that to happen?
Well, there are a lot of things that can disrupt the delicate balance of the ANS, and one example that's actually discussed in ANSpharmacology.pdf is a condition called myasthenia gravis.
Myasthenia gravis, I'll be honest, I'm not familiar with that one. What is that?
It's an autoimmune disorder. Basically, your own immune system mistakenly attacks the acetylcholine receptors at the neuromuscular junction.
Okay, back up a second. The neuromuscular junction.
Sorry. It's a mouthful. It's just the fancy medical term for the connection point between your nerves and muscles.
Got it. So with myasthenia gravis, the immune system is basically attacking the communication lines between nerves and muscles.
That's a great way to put it. And because those signals aren't getting through, the muscles don't get the message to contract properly.
Oh, wow. So someone with this condition, what kind of symptoms would they experience?
It can manifest in different ways, but muscle weakness and fatigue are really common. Things like eye movements, facial expressions, even chewing or swallowing can become difficult.
Wow, that sounds really challenging to live with. Is there a way to definitively diagnose myasthenia gravis?
There is. There's a medication called edrophonium that doctors can use to help diagnose it. Essentially, it provides a short-term boost in acetylcholine levels.
So it's like temporarily amplifying the signal to see if it gets through.
Exactly. In someone with myasthenia gravis, giving them edrophonium often leads to a noticeable, although temporary, improvement in muscle strength. It's a pretty reliable way to confirm the diagnosis.
It's like a real-life trace the call for the nervous system. That's amazing. This deep dive is really highlighting just how important a healthy, properly functioning ANS is for, well, basically everything.
It really is. It's a testament to the interconnectedness of our bodies and how even the tiniest disruptions can have these ripple effects throughout the entire system.
Seriously, it really makes you appreciate all the behind-the-scenes work our bodies are doing every second of every day, even when we're totally oblivious.
Right. And the craziest part is, we're still just scratching the surface when it comes to understanding everything about the autonomic nervous system.
I totally believe it. I mean, we've covered so much ground today, from fight or flight to, tracing nerve signals like their phone calls.
It's been quite the journey.
It really has.
Yeah.
But I have a feeling this is just the tip of the iceberg, especially when it comes to the role of the ANS in our overall health and well-being.
Oh, absolutely. There's so much more to uncover.
So before we wrap up, any final thoughts for our listeners, something to get those synapses firing?
Well, given everything we've explored today, I'd love for you to consider this. What other aspects of our health might be influenced by the ANS?
Oh, like what?
Well, we touched on the connection between the ANS and stress, right? But could there be a link to other conditions too? Like chronic fatigue, maybe, or digestive issues?
A gut-brain connection.
Exactly. There's still so much we don't know, and that's what makes this field so fascinating. So, to our amazing listeners, keep those questions coming and keep exploring. Who knows what other incredible discoveries are waiting to be uncovered?
I love it. The ANS might be working behind the scenes, but it's clearly a major player in the game of life. A huge thank you to anspharmacology.pdf for being such an incredible guide, and to you, our amazing expert, for sharing your knowledge with us.
My pleasure.
And to you, our listeners, thanks for joining us for this deep dive into the incredible world of the autonomic nervous system. Until next time, take care of your inner autopilot.